Welcome, ladies, to the Valder Beebe Show.
Thanks for having us, Valder.
Thank you, Dr. Chow. Thank you so much, both of you, for being here. We're going to talk about, I want my audience to know for the first time, maybe you're just hearing about temporal dementia when it was announced that megastar Bruce Willis had this disease. I know I had never heard of it. This segment is for caregivers and relatives. Dr. Chow, thank you so much for being here to educate us, because I don't think we're educated in this. Would you tell us what the disease is and then how it acts?
Frontotemporal dementia, or FTD, is called that because it affects the front half of the brain. And the front half of the brain is what helps you to project a personality to the rest of the world. It helps you to communicate to other people what motivates you, what you're really into, and what your plan is, how you might organize your tasks for the day. So imagine losing those abilities would really make you unrecognizable to the people who know you best. And you might surprise them by being uninterested in things that you had an absolute passion for before. The other piece of this that is very different from Alzheimer's disease is that people start to have these symptoms much earlier in life. The average FTD patient starts in their 50s, and there are patients who are affected in a different way, and they may start even earlier in life. So imagine a middle-aged person showing maybe not so much motivation, it looks like career burnout, or maybe it looks like midlife crisis or depression. And calling it those things leads to a certain treatment pattern, different expectations for what's supposed to happen with the patient, and it's very confusing for families because they're seeing that the person's continuing to get worse over time instead of better.
I just want to ask you, are we separating the diseases as maybe Alzheimer's as a parent disease, and these diseases come under that, dementia, front lobe dementia?
That's a great question. Dementia is used synonymously back and forth with Alzheimer's disease, but there are actually several different causes of dementia. Frontotemporal dementia is very separate from Alzheimer's disease. It's very rare for anybody to have both of them at the same time, partly because of that huge age difference. I said FTD, think 50s or earlier. Alzheimer's disease, generally 70s and later.
Thank you so much for that great explanation, Dr. Chow. And I know you brought Deb with you. And if I can ask Deb to tell her, just give us a little bit about her experience of caring for a loved one on FTD.
Yes, my story starts at a younger age of 38 years old. My husband started having changes at that young of age. We owned and operated a business, and we saw some changes in him throughout the years, and we ultimately had to close the business due to some paranoia, delusionals, and unable to make the tasks, complete tasks and make the car repair business work. And then throughout the years, he couldn't keep jobs, and he was in and out of different opportunities in life. We went to physicians, and they thought different things of depression and those types of things, on and off medications. Finally, at the age of 44, we were finally diagnosed with FTD, and at this point we could not have him stay at the home any longer due to behavioral issues, along with him wanting to continue to drive. I was 40 years old and had to continue to work full time, and my daughter was a senior in high school, and so we had to make the tough decision of having to have him become a resident in a nursing home to keep him safe, along with my daughter and I. So it is a very hard and devastating disease on our family, along with friends, along with your finances. It's something that I don't wish on anybody. It is very tough.
Deb, thank you so very much for sharing your personal journey on this. Dr. Chow, how do you find this out? She seems she had a long road just to find out what was wrong.
Absolutely. Most patients are delayed by 4 to 8 years in getting a diagnosis. And although there is no FDA-approved treatment specifically for FTD, the amount of education and support that we can give to families is really important to start as early as we can. Part of that support is to warn people that up to 40% of persons living with FTD actually have a strong family history of similar symptoms that may not have been diagnosed as FTD, but which might make you concerned that there's a genetic mutation making its way from generation to generation. And if a person diagnosed with FTD has one of these genetic mutations, they have a 50-50 chance for each child to get the same illness once they get to their middle ages as well.
That's startling and information. Dr. Chow, I'm going to wrap up with Deb. Deb, you've walked this journey. What do you want people to know about FTD, and where can they go and get more help?
I want you to don't be afraid of genetic testing. Our children decided to go ahead and do this just because of childbearing ages, and we do not want to spread it on to the next generation. Our mission in life is knowledge is power, and we want to not be afraid of science, and we're praying to God that they'll listen to us and that we can be able to find a treatment to stop it in its tracks. Please go to learnftd.com and get yourself some education and learn about FTD and how we can make an impact and make a change.
I want to thank you, Deb, and I want to thank Dr. Tiffany Chow to let my audience know that Dr. the VP of Clinical Development, Neurology at Altecor. I'm not sure if I'm saying that right, but she's great on information. Ladies, thank you so very much for being here.
Thank you so much for having us.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/Valder Beebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/Valder Beebe Show and stay connected as I interview the world's most fascinating people.